right, welcome everyone. We'll go ahead and get started. My name is Lauren Williams. I'm Adult Community Services Manager here at the Columbia Public Library, which is part of the Daniel Boone Regional Library System. Welcome to today's Lunch and Learn. We'll hear from Rebecca Rosslet, who is Columbia Boone County Director of Public Health and Human Services, about the very important topic of public health. Today's Lunch and Learn is co-hosted by the library and the League of Women Voters of Columbia Boone County. We have people attending both in the room here in the Friends Room at the library, as well as on Zoom. So I just have a couple of Zoom housekeeping items. If you're participating on Zoom and want to ask a question, please use the chat feature. And if you would, in the drop-down menu, when you select chat, if you would select everyone to be able to see your chats, that way everyone can see what's been asked. And then when it's time for those of you here in this room to ask questions, I'll be walking around with this microphone just to make sure that everyone participating on Zoom can hear the questions asked. We're recording this presentation, so it will be available in the next few days on both the League's YouTube channel and the library's YouTube channel for future viewing. And now I'd like to welcome Marie Scala of the League of Women Voters to say a few words about our speaker.
Thank you, Lauren. Thank you, Rebecca, for being here today. Rebecca has been the director of the Columbia Boone County Department of Public Health and Human Services for almost 2 years now. And before that, she served as the assistant director, during which time she was responsible. She had a lot of responsibilities, day-to-day operations, management of personnel, with a team of managers and supervisors, of course. She assisted with the financial management. She collaborated to deliver services in Boone County and outside of Columbia, and to assure department compliance with local, state, federal policies, ordinances, and protocols. Good job. Prior to that, she was public health planning supervisor. So she was involved in epidemiology and disease containment, oversaw disease investigations and contact tracing, and coordinated the community health improvement plan, and work closely with local partners to identify public health needs and gaps. Prior to working for Columbia Boone County, she previously worked at the state of Missouri in the Division of Family Services. And in the roles she had there, she provided case management of children, families, older adults, and those with additional needs, referred them to local resources, and investigated reports of abuse, neglect, and exploitation. She earned her bachelor's in psychology and her master's in public health from MU, and most recently earned a certification from the Harvard Kennedy School of Executive Education Leadership in Crisis 2024. We're very fortunate to have her here today to talk about the changing landscape of public health.
Thank you, Mari. I appreciate the intro. So as Mari mentioned, I'm Rebecca Rosslet. I'm your public health director. I'm the public health director for the city of Columbia and Boone County. Our local health department is one of only 3 in the state of Missouri that is a city-county health department. So in that way, we're a little bit unique. As a city department, I have a responsibility outside of the boundaries of Columbia to include the entirety of Boone County. So that's a little bit of a nuance in my department in particular. So I'm going to talk a little bit today about some of the things that your health department currently does and highlight a few areas where we know we still have some work to do. And then we'll go into what are some of the changes that we've seen in public health, especially in the last 12 months, because there's been quite a bit. So this is our building. We're on Worley Street at the corner of Worley and West Boulevard. We're in the old Knowles grocery store. We are in the produce side of the old Knowles store. I think Compass is on the liquor store side if you used to shop there. So we moved into this building in 2004. When we moved into this building, we had about 60 some employees, and now we have 105. So we've seen tremendous growth. We're kind of busting at the seams there. The downside to an old grocery store is that it's got a flat roof and you can't build up. But part of our growth over the last 20 years has been due to federal and state funds that have been allocated towards public health, especially post-pandemic funds. And so then as we look at the budget, you'll see just how much federal and state policies and laws and budgets impact your local public health services. So these are our different divisions. Just to highlight a few things, our admin division is where you get your birth and death certificates. So a lot of people think, oh, I never go to the health department. Well, if you get your driver's license in Missouri, at some point, you've probably been to our health department. Or if you've lost a loved one and all the paperwork that goes along with that, the funeral home administrators probably come to pick up those vital records. We have animal control in Columbia and Boone County. That's part of public health because of the rabies connection and injury prevention as it relates to animal bites. In a lot of municipalities, it's part of law enforcement. One thing I always like to point out with animal control is that if you find a bat in your house or in your local library, in the building where you are, do not touch it, and most importantly, don't let it out. I think our instinct is to get it out of the house. Well, then we can't test it for rabies. So what we really want is that if you find a bat, close the door of whatever room it's in and call animal control. They will come out, they will capture that bat, they put it in an old Folgers coffee can, and we send it off for rabies testing. And that rabies testing allows us to know whether or not you've been exposed. Bat bites can be so small, especially if it's in your bedroom, you may have been bitten and without even realizing it. So we really want to be able to test those bats. The other thing is, if you have indoor kitties, keep up with their rabies vaccines. Sometimes folks, you know, if you think, oh, no other animals are coming in, it's an indoor only cat. If you have a bat exposure in the house, the recommendation is to euthanize an unvaccinated cat. So you really want to stay up to date on those vaccines. Our community health division, they spend a lot of time working on diseases that people give one another. Those are communicable diseases. We love worrying about that in public health. Environmental health, these are the folks you can't escape from. So if you go into any restaurant, gas station, school, daycare, nursing home, any of those places in Boone County, somebody in environmental health was there before you to make sure that the food is being properly handled, it's at a safe temperature, that the ice machine has been cleaned on a somewhat regular basis. Environmental health is always behind the scenes, making sure all of those amenities that we love so much and make this such a great community are healthy and safe for consumption. And restaurant reports, those are all public records. You can access them on our webpage. And there is a reporter that likes to report out on the public records. We even go into gas stations if they sell food, and ice is food. So any place that has ice is a food establishment, and we have to inspect those as part of our safety protocol. So yeah, we probably inspect your little kiosk out there. So health promotion is really looking at some of our naloxone work. We'll go into that a little later. We do a lot of social services and of course our WIC program. So let's talk a little bit about who pays for public health. I know you probably can't see this very well, but I can certainly share, or Lauren has this if you want an email version. But in the state of Missouri, per person, Missouri pays $6.67 for public health funding, compared to Tennessee, which is $72. So Missouri has the lowest funding for public health in the United States.
Is that a good thing?
No. No. And a lot of other states will fund public health. You know, some will use tobacco tax money for that. Some will, I mean, there's a variety of ways that they do that. But what that really shows you then, that pie chart is my budget as public health. So we have a $16 million budget, which is probably, I think, like the fourth largest budget for a general fund account in the city's budget. So I share the same budget as police and fire and public works and parks. So of my $16 million budget, 32% of it is money that we get from the federal and state government. So our department is heavily offset by state and federal grants. So when you see changes at the national level related to programming for mental health, food, any of those types of things. Those have a direct impact on public health services that we can provide to our public and our most vulnerable. And then the county, because I am a city county health department, pays for 33% of our remaining operating expenses. And then we have a little bit in fees, not a lot in fees, because our job is to keep the public healthy and safe. And we don't really want to charge you because you have tuberculosis. Like, we want to be able to treat your tuberculosis and help reduce the spread of that. So, again, yes, Missouri, very, very, very low in the public health spending. Okay, some of our clinical services that we provide, these are things that not everybody's aware that we do at the Public Health Department. We do women's health care. We offer low-cost birth control and emergency contraception. We do a lot of pregnancy testing. We do a lot of HIV work. Our HIV work has really increased in the last 3 years. So we've done HIV testing for decades and a lot of HIV prevention work. But where we've expanded is now we have the full continuum of HIV services and related services. So we do HIV prevention, testing. If you test positive, we have case managers that immediately work with you to get you into care and to provide you any supports you need. We have disease intervention specialists that are going to notify your close contacts and have them tested. We also do pre and post exposure prophylaxis. So we're really kind of a one-door comprehensive approach to HIV in Boone County. And we also do STI testing and treatment. So in my brain, that will always be STDs, but the language now is STI, for sexually transmitted infections. We do a lot of that work because, again, those are diseases that people give one another. We will treat you at our location. We notify close contacts. We get them in for treatment so that we can reduce that disease spread. WIC, I'll talk about WIC for just a little bit because this one's been around since maybe the 70s, maybe the 60s. WIC was part of an ag bill. WIC is a federally funded nutrition program that provides vouchers for healthy foods for pregnant moms, infants through age 5, and adult caregivers of those children. So WIC used to give you like paper vouchers. You would see people use at the grocery store. Now it's all on a card, which is amazing because it makes everything go faster. It destigmatizes WIC to some degree. So WIC has very specific parameters on what you can purchase with your WIC food, with your WIC dollars. So food stamps or SNAP is something that does not yet have strict parameters, but that's changing. WIC is very much, you can get milk, you can get juice, you can get fresh fruits and vegetables, you can get baby formula. We serve about 1,200 families a month with our WIC program, which is a lot of moms and kids that are getting help at the grocery store. And when you're in the grocery store, if you're ever trying to decide between a row of options, you'll see little purple stickers that say WIC approved. And that's, if I'm trying to decide between 5 juices, I always buy the WIC approved one because I know that it has met the highest nutritional standards, because that's what WIC does. It will only allow for high nutritional standards. It's going to have lower sugar. It's going to have lower sodium if it's that type of food. So we saw an uptick in WIC participants when SNAP was on a temporary pause. You guys might remember when food stamps were paused for a length of time. We saw an uptick in families coming in to get on WIC to try to help meet that financial gap they were seeing. We've had some recent changes with what WIC will cover. Some of them surprised me a little bit, like you can no longer get yogurt with WIC or name brand cereal. And the only cheese you can get is shredded cheese. So no block cheese, no string cheese. So just some, yeah, I know, I don't have an explanation for that. So when things start to change at the federal level with like food pyramids and things like that, that all has a trickle down effect into things like what you can purchase with your WIC dollars. We also do a lot of work with breastfeeding. We have really high breastfeeding initiation rates in Columbia Boone County with our moms who breastfeed. And we know that sets these babies up on a good trajectory in a lot of ways. And so we also have breastfeeding peer counselors that work with our WIC moms to help them continue breastfeeding as long as that's a good fit for their family. Okay. Let's talk a little bit about naloxone. I think the library has hosted several Save a Life events. Naloxone is the generic for Narcan. We've heard about this a lot recently. This is a box that sits outside of my building on Worley and West Boulevard. Looks like the old Tribune newspaper boxes. You just pull it down and grab as much naloxone as you want. So naloxone is to reduce potential opioid overdose. It is a life-saving medication. In my brain, it is just part of a community first aid kit. The same way you'd have an AED, you would have naloxone available. Opioids are a whole other topic that somebody other than me is much better equipped to speak on, but it is something that we watch very closely in public health. It requires a lot of collaboration and education. Synthetic opioids are being produced every day, probably. So naloxone saves lives. If your life is not saved, you do not have any opportunity for treatment ever. So our focus is really on life saving. We have been able to, through a grant, purchase these boxes, and they're in multiple key places around the city and the county. So every city fire station that's on city property has a naloxone box outside of it. We just put one outside the Arc. There is one at Flat Branch Park. And then we have some out in the county as well. So it's a come and get it anytime you want thing. We get the naloxone free through another grant, and we restock it, and we don't keep tabs on who takes it or when. We do not care. It does not work if it never leaves our building. Like, it needs to be out in the hands of people who need to have that. I have some on me. Like, it's just something that you want to have. You won't, if somebody is not having an opioid overdose and you give them naloxone, you will not harm them. It is a safe thing to have on hand. So the Save a Life events are things where our staff go out and they do education in the community about opioid overdoses and naloxone. Everyone who attends is given a box of naloxone to have on their person. I should have brought some boxes with me today. I'm sorry, I didn't think about that. But you can pick it up at the health department, just pull up and grab it out of the newspaper machine. So that's something that public health is spending a lot of time on, trying to reduce those opioid overdoses. So let's talk about babies. So this one is pretty depressing. Missouri has one of the highest infant mortality rates in the United States. So these are babies that are dying before their first birthday. And let's see, the rate is higher than the national average and saw a 16% increase between 2021 and 2022. And Black infants are more than twice as likely to die as white infants. So this is pretty staggering. I mean, there's no other word for it. It's babies are not supposed to die before their first birthday. So in public health, we are working on something called the Fetal Infant and Mortality Review. So this is a contract that the state gave us. We're covering 18 counties, and they're pulling together subject matter experts and people with lived experience in this very tragic public health event, and looking at not the medical components of it, not like, is there any malpractice? That's not the focus. The focus is, did mom have access to good nutrition? Was mom able to get in to see a prenatal care provider within a reasonable amount of time? If she wasn't, why? Was it because of transportation? Was it because she didn't have childcare for her older kids? Like, looking at those social barriers that might have contributed to this terrible event that happened in the life of this family. So that's work that we're getting started on. Our contract for that covers 18 counties. Our HIV contract for case management and prevention work and our disease intervention specialist work, we are the regional hub for those particular services, and that's because Boone County is the biggest. We have the highest number of cases, we have the staff with that expertise. And so the state on occasion will have us take these regional based contracts. So I have staff that will drive 4 counties away to work with somebody who needs HIV case management. And the fetal infant mortality review is another one where we're doing that regional approach. Okay, so as I mentioned, we do a lot of STI, testing and treatment in Boone County. Females have higher rates than males. More than 1.5 times more likely than males to receive a diagnosis and treatment with chlamydia. And there's some disease rates up here. Syphilis is having a comeback. Syphilis has been, they used to put syphilis on World War II posters to warn the troops about syphilis. We are still dealing with syphilis, and we're starting to see it more congenital syphilis. So moms who are pregnant and have syphilis, we're starting to see a resurgence in that. And syphilis is treatable. So we want to know early, and so that it can be treated before it has some of the most severe outcomes that we've heard about throughout history. But that is something we're watching very closely and doing a lot of testing and outreach and then treatment for syphilis. And then Black women experience disproportionately higher rates of STI testing and diagnosis, including ongoing inequities and sexual health outcomes. Okay, so talk about a changing public health in 2026. Here's one of the big ones. There were some immunization changes. There were a lot of hearings about this. We all watched most of it. So one of the big changes was a recommendation over the hepatitis B vaccine, which previously was given to babies upon birth in the hospital, and now it's a conversation between the family and their medical provider. It's an opt-in. I think previously it might have been more of an opt-out model. And so you can still have your baby vaccinated at the hospital for Hep B if you wish, but that is a decision that has to be made at that time. Any mother who tests positive for Hep B will still be required to vaccinate their child at birth. There's also been some changes to the immunization schedule. So the government reduced the recommended childhood vaccination schedule from 17 diseases to 11, which aligns more closely with European models like Denmark. So what does that mean for local families in Boone County? So the health department has not made any changes to the vaccines that we offer. It's still the same. We have a shared clinical decision-making and a discussion with any adult that brings a child in for vaccines. We will answer any questions that they have. Not me, I'm not a nurse, but our nurses are very, very trained and knowledgeable in that. And then the adult decides which vaccine they want the child to receive, and that's the vaccine that they get from us. The thing that we worry about in public health and others is that when things are not recommended, are we going to come up to a point where insurance isn't going to cover it? So that hasn't happened yet, but that is something that you start to worry about being like 3 years from now. If this is no longer a recommended vaccination, is my health insurance still going to cover it, or is it going to be considered an optional service that I would need to pay for out of pocket? And vaccines can be incredibly expensive. The other concern we have about this is that as those numbers start to shrink, are providers still going to carry the full array of vaccines? So we will at public health because it's one of our core functions, and we have other mechanisms to get low-cost vaccine as a public health department. But if you're in private practice, vaccines are really expensive and you have all of your cost up front when you purchase the vaccine. You don't want to waste any of it by not having the volume of patients who take it, because if it expires, then you've lost, you have no ability to recoup your expenses. They have very specific storage parameters. We've got generators that are building just to keep the vaccine safe. So there's a lot of nuances to hosting vaccine at your location. And as changes happen, I am concerned that some private or smaller entities might not be able to keep as much vaccine or the whole spectrum that we're able to. And then that just limits a family's ability to have their child vaccinated. Let's see. Oh, measles. Okay, let me get to that slide. Much like syphilis, this old buddy's coming back. So we've seen an increase in measles in the United States. So in 2024, we had less than 300 cases of measles. So far in 2026, we've had 1,281 confirmed cases of measles. So measles elimination status will be reassessed this year. So you reach a certain point where you've reached an elimination status, like with polio. And then as you have a resurgence in cases, it's like you've lost that badge. Like you've no longer eliminated measles in the United States because now it's back. So there was just a recent case in Missouri, in Kansas City. Knock on wood, we have not had a measles case yet in Boone County. When we do, measles is one where you tend to see a press release about it. And the reason for that is because it is so contagious, and because if I have measles and they test me tomorrow, we would have to do a press release on every place I was in public today and going back a few days, because anybody that was in that shared space with me, either at the same time or for a few hours afterwards, has potentially been exposed to measles. And so that's why when it happens, you hear a lot about it in the press. And we would never just share anybody's name or their identifying information, but we would have to share where you went so that others that were in that same shared space, if they are not vaccinated, have the opportunity to talk to their medical provider about, should I get a vaccine? That's really, I mean, the one good thing about measles is we have an approach. We have a vaccine. When COVID started, we didn't have a vaccine. Like, that's our main tool, and we did not have that tool in our toolkit. We have that tool with measles. It's been around long enough. We know how it spreads. We know how long it takes for you to show symptoms. We know how long you're contagious, and we have a vaccine. So although I do not want to see measles in our community because it can have devastating impacts, we know how to address measles when it happens. And I will use when, because given the nature of 1,200 cases in Missouri, in the United States, I think it's a win. Okay, so this is looking at our vaccination rates in Boone County. So these are looking at kindergarten vaccination rates. So in the state of Missouri, schools can still require vaccines or proof of vaccines at the time that you're enrolled in kindergarten. So that's really a key metric for public health, to look at the vaccination rates of your community, is how many kiddos are fully up to date at the time they start kindergarten. So for measles, for example, you need a 95% immunization rate in order to have herd immunity. And herd immunity is really, like, we have some kids who cannot take vaccines. Either they are immunocompromised, they're going through cancer treatment. Like, there are just some individuals where it is medically not recommended for them to be vaccinated. So we need everybody around them to be vaccinated. That's the herd immunity, because it stops the disease from getting to that one individual that cannot receive the vaccine. So in Missouri overall is at 90%. So Missouri does not have herd immunity. And in Boone County, we are at 95.15%. So we are like hanging on by our fingernails. So, and this was in 2024. So we are faring much better than a lot of other counties in Missouri. Some counties are in 80%. So Boone County is in much better shape than some of our peers. But your health is impacted by your neighbor's health. So if the counties surrounding you have lower immunization rates, diseases don't care about geographical boundaries. And this is a community, we're a hub in central Missouri, so people travel here for entertainment and goods and services and medical care. And so we are impacted by the health of those in central Missouri and surrounding us. We're nationwide, there's an increase in people who are requesting exemptions to vaccinations. And I think we're going to continue to see that trend grow. That's really a post-pandemic trend. So more families are opting not to vaccinate. And so I think we're going to continue to see some diseases that maybe we haven't seen in a while. So, I mean, we have some medical providers who've never seen measles. And probably hoped they never would. Okay, the food pyramid is another big one that's had some changes. This is the history of the food pyramid. We can all remember these different graphics that we've seen over the years. And the food pyramid, it matters for many reasons, but it impacts things like WIC. Like this is where you pull information from when you're deciding as a policy what you're going to pay for, what you're going to allow with WIC vouchers. Same thing with SNAP or food stamp benefits. As those benefits become more restrictive and they start to put guardrails on what you can purchase, they'll be looking heavily at the food pyramid to decide what's going to be allowed. So it also impacts military-based food choices, which I did not know until I read that in this slide that somebody else put together for me. And I haven't read this anywhere. I'm just making an assumption here, but I would imagine this is going to impact school lunches too, because it's all part of the same funding. And a lot of our families rely very heavily on food at school as a primary nutrition source for their kiddos, breakfast and lunch. And at some schools, they even do a sack dinner. Something I failed to mention that we do is that we do a summer feeding program, which is an extension of our WIC program. So, you know, when school's out for summer, those kiddos can go hungry. And so we have a program, it's a partnership, and the state offsets the cost of it to provide sack lunches to children, anyone under the age of 18 during the summer months. And we currently provide that food at the Armory. There's several feeding sites throughout Boone County. Ours is at the Armory because it's part of the city, and then we're able to serve food to the kiddos who are spending their day at the Armory. So food insecurity is a big concern. It's a lot of people go hungry in our community. Oh, okay. And then to wrap up, because it's Women's History Month, here are some incredible ladies of public health that I wanted to make sure we mention. Florence Nightingale, of course, founder of modern nursing. Dr. Virginia Apgar. I'm really glad that she got to name it after herself, who came up with the Apgar score, which we use today when babies are born to determine how they're doing. Dr. Corbett, who was the leading scientist behind the Moderna COVID-19 vaccine. And of course, Dr. Elders, the first Black woman to serve as the U.S. Surgeon General. So thank you to these women in public health. We stand on their shoulders every day. So any questions?
I just want to go back to talk a little bit more about the new food pyramid.
Yeah.
One of the things that affects all of our health is our socioeconomic status. And when I first heard about this, I was thinking, okay, that sounds wonderful, but the emphasis on protein especially and on both healthy fats and even fresh fruit and vegetables, all of that, makes food more expensive, say. And I just wanted your take on what impact this might have on the ability of food service programs like your summer feeding or school cafeterias to actually comply with this and for families to be able to adhere to these guidelines.
So, and again, this will be making some assumptions because I don't have all the facts on this yet. When I look at this and I think about my own grocery store trip and how much it has changed in the last 12 months and how much I'm staring at all of the meats and looking at the cost. And when you have, I mean, so many people in the United States, they have a limited amount of income. And your set income is not changing because your food costs are going up. So if you are getting your pension or Social Security, or you're on disability, or you're receiving food stamps, like there is a cap and you don't have the option to like work more or do a side hustle or anything to increase that. So it's kind of hard for me to imagine looking at this, how much salmon I could get. How far is that going to stretch my SNAP dollars if I'm get it? Because parents want to feed their kids healthy foods. They want to fill their bellies, feed their brains everything that they need to do well in school. They want their kids to be well nourished. But this is I mean, I don't remember ever eating shrimp as a kid. Like that would have been so luxurious. So I'm worried about its practicality and how would a school produce a mass lunch for 1,600 kids following this guideline? I don't know what that would look like. I don't know what it will look like if your SNAP dollars are heavily impacted by this new food pyramid and some of the bulk sustain you, fill your belly things that a lot of us grew up eating a lot of, like pasta and rice. If that's not, I'm not sure, Maury. It's time will tell, and I think it's going to have quite an impact.
This is in the same line as you're talking about. Who determines what meets the requirements for WIC purchases?
I believe that's coming from the feds out of Department of Ag.
You don't have anything to say about.
No.
Like,
You might need to repeat.
Yeah,
the
Oh, I'm sorry. The question was who determines what foods are allowed for out of WIC? And that's happening at the federal level. And WIC is the same all across Missouri. So the WIC that you receive in Boone County, you can go and you can spend it in Callaway County and you're going to have the same rules. So we have no local decision making within WIC. They pay us to distribute that program following their guidelines, and that's what we do.
I'm amazed at how much you do. I'm curious how big your staff is, because I can't imagine they all fit in that building. But do
You
you,
can't believe it either.
do you have partners that you work with and delivery of anything? Like does Compass next door help you with medical or I mean, you can't all fit in that building.
Sure. So we have about 105 FTEs in our building. It is very tight. And when I walk in other buildings that are not mine, I'm like, oh, I could fit like, you know how many cubicles I could get in this? So we're constantly thinking of, you know, if I hear of a city building that's being vacated, I'm like, well, is there gonna be room? So we're very mindful of that. But we also really love where we are. Because we're in the central city and we're on a bus line and we have good sidewalks and we have free parking. We used to be downtown, where the municipal court building is. And, you know, you would see moms like running across Broadway with their baby in a stroller to get to WIC. And our WIC numbers exploded when we moved because you could park there and safely get your kiddos out. You didn't have to pay to park. So, we partner a lot. There's something we call the public health system, which is much bigger than us. the library is part of the public health system because this is a hub, a community hub where people come for resources. And we partner with the library a lot on things related to public health because they're trusted. And you get a lot of good work done when you work with the trusted individuals. Yeah, I mean, you need that partnership in order to form that bridge between whatever population you're trying to reach. So we partner a lot with our FQHCs, which is Burl and Compass. We work a lot with nonprofits and social service agencies, very heavily with them. We have some, if we work closely with infectious disease and physicians and at the hospital, because back to talking about diseases people give each other, there are certain diseases that if someone tests positive for it, you're required by law to report it to the health department. And so if you go see your private provider and you test positive for syphilis, they are required by law to report it to us or to the state and then to us, so that we can do proper notification and treatment. So we partner a lot with those entities. We do a lot of tuberculosis. That's still around. That is around and people get it and we do a lot of work with it, and it's something that no one really thinks about anymore. When was the last time you heard somebody talk about TB? I have 3 full-time nurses that just work on tuberculosis. So it's really something.
We have an online question. What do school dietitians say about the new food pyramid?
I do not know what school nutritionists say about the new school food pyramid. That would be a great question for CPS.
I had a question about the number of vaccines that are going to be recommended. When it goes from 17 to 11.
Right.
Do you know offhand what some of the ones that they're no longer recommending are?
No, and I don't want to guess.
Oh, that's fine.
Just a funny comment. One night, my husband and I were asleep in bed and he suddenly jumped up and he said, "There's a bird in the bedroom," and it was a bat.
You don't want that.
We did not know we had to capture it. He coaxed it out of the house.
Yep. Yeah, even when my kids were little, I didn't know that until I worked at the health department and I would quiz them. What do you do? Find the bat in the room. Well, I grab Nora and I walk out and I close the door. I'm like, yes, that's what you do. So yeah, most people don't know that because your instinct is just to get the critter out of your house. But then you run the risk of, well, do you now have to do rabies prophylaxis because we can't test the bat? And we always want to test the bat.
This was a long time ago.
Yeah. We come really quick if it's a bat call. Middle of the night, they're on call.
You may want to get that word out.
Yes.
My question is about the services, for example, like the vaccines to seniors.
Yeah.
Are there limitations on income for your services?
So there are not. So we do flu vaccine, those types of things. There's not an income limitation. We have some nuances to the payer type. So Medicaid, Medicare, no problem. When people have commercial insurance, it may not be a commercial insurance that we're able to bill. And so then they would have some out-of-pocket cost. Something else I will mention that has changed with the shared clinical decision-making, which is a new part of vaccinations. So we did school-based flu shots forever. Our nurses would go into the schools, the parents would sign up and kids would come in a row, and it was very like back in the day when you would stand in line and get your vaccines at school. So we stopped doing that this school year because we lost some funding and we needed to trim some expenses. And so that's one of the things that we stopped doing. The reason for that is, for one, our number of kids who got shots at schools had been decreasing because there were a lot more access points. There's just a lot more places you can get vaccines. And there's also a nationwide trend in people taking fewer vaccines. So we put a pause on it for 1 year. We're like, we'll see what happens and we'll see if we can find any funding to bring this back. Well, now with the shared clinical decision-making component, even if we found funding, we can't bring that back because the trusted caregiver adult is not there present with the child. And we have to have that conversation with the parent or the custodian in order to do that shared clinical decision making. And that's not feasible in a school-based setting. I mean, previously parents or guardians would fill those sheets out at the beginning of the school year, and then we show up 3 months later and vaccinate your child, and we're not gonna be able to do that anymore. Because of the need for that shared clinical decision making.
I have a quick question, and thank you so much. This has been so informative. I thought I knew a lot about the Department of Health and learned a lot more. And this is a question that maybe I could have Googled, but
Well, I'm
I'll
here.
just ask you.
Yeah.
So, for measles, is it a booster shot recommended? You know, like I had that years and years and years ago.
So,
Say
I have a graphic that I should have put in this, and I can email it to Lauren if you want. It's like a flow chart. Were you born before this year? Yes or no? Were you born after this year? Yes or no? So the answer is probably no. You probably don't need a booster, but I can share that flow chart. It's a great reference to look at and see if you do need one. If you ever had an exposure, it would always be wise to ask your healthcare provider at that time.
This one, someone. Okay. I just wanted to interject that in response to a previous question, one of the vaccines that has been taken off the list is hepatitis A. And as a long-term public health person myself, I personally worked outbreaks of hepatitis A, which people died. Worked a massive outbreak caused by a fast food worker. It is transmitted through the gastrointestinal tract.
Right.
So it's transmitted the same way as Shigella or.
Yeah, oral fecal.
Right, right. And I'm just gasped in horror when I heard they were eliminating that as a recommended vaccine because it is transmitted to a large extent by young children who admittedly don't suffer effects from it if they get it as a young child, but when you pass it to adults, very serious.
Yes, I mean, our most vulnerable for those types of illnesses are gonna be your seniors or your super seniors or your babies or pregnant women. And you're right, an astonishing number of diseases are passed through food. Whether it is temperatures were not kept in the range where they should be, or food was left out too long. Please don't throw your meat on the counter. After 4 hours, food needs to go in the trash. When you stock your refrigerator, your raw meat needs to go on the bottom and with a plate underneath it to catch any drippings. Because if you put it at the top and it drips down on all your raw fruits and vegetables that you don't cook, now you've potentially contaminated your food. You can get really sick just by having lunch. Yeah, wash your hands. Wash your hands. And assume that no one else ever washes their hands, so wash yours a lot.
I'm really curious, if you, are kind of self-regulating or if you then are responsible for a body at the state level, and then whether or not you have some kind of a voice in Jeff City, to advocate for more countywide. This is knowing what you know about your own county.
Yeah.
Makes sense.
So as a government employee, I cannot advocate. We can talk to our elected officials and provide education, but we cannot do any advocating or protesting or suggesting they vote one way or the other.
How about testimonies then?
We've done that
Okay.
because that's education. So if there is a topic at hand that we feel will have a certain impact on public health, we can educate on what that impact is. And we've done that. Public health, because so much of what happens at the state level impacts all 101 counties in Missouri or however many they are. People from other health departments will go down and testify on behalf of local public health agencies in Missouri. And we also have some bigger groups used to be called Missouri Center for Public Health Excellence. Now it's called something else, but they really they have looser parameters and they can really advocate for public health in Missouri. At the local level, we're really fortunate. I mean, I used to work in state government where you can feel like you can't affect any change. I love working at local government where you can. So at the local level, we really have the ability to impact things locally to Columbia and Boone County. If it's within our control, if it falls within our ordinances or the county's ordinances, we have the ability to make those changes. But when 32% of your funds comes from the state or the feds, they give you those parameters and you're contractually obligated to follow them.
Any last questions?
Just have an advance.
Oh, thanks, sure.
Thank you.
You're welcome.
Very much.
Yeah, not a minute left. If you have a little.
Or go see the exhibit upstairs. Just want to remind everyone, our next Lunch and Learn in April will feature a very timely topic. We'll have Gina H. She's a policy analyst with the Missouri Budget Project. And she'll be our speaker on what you need to know about taxes in Missouri in 2026. There are big changes in our taxation system being debated in Jefferson City, so I'm sure she'll address that. And then also want you to mark your calendars between now and then, March 19th at 6 p.m. here in the Friends Room. We'll have the league candidate forum for the April municipal election. So please point the time and find out about the candidates who will be on the ballot and ask them questions. Thank you very much.
Thank you, everybody.
So would you?
Show me them off. I mean, the shots.
It might.
Yeah.
Before this.
Yeah.
Are we?